My name is Dr. Rashmi Halker Singh, and I'm the Deputy Editor of Headache. It is my pleasure to be joined today by one of my good friends, Dr. Christina Szperka, who's going to be talking to us about her paper, Diagnosing NDPH in Children and Adolescents, a Survey of Clinicians. Welcome, Dr. Szperka.
Thank you very much.
So first of all, can you tell us about your study?
Sure. Thank you for this opportunity. So this study really grew out of clinical experience. Dr. Gelfand, my co-author, and I, we've been thinking about how can we make our patients' lives better, right? So we have patients who fit into a number of different diagnoses, and migraine is, of course, a very common one, but it's also more studied. We have a lot of kids who fit into either official criteria for NDPH or something that's similar and aren't necessarily eligible for trials. And so as a long-term goal, we've really been thinking about how can we get to the point of being able to do studies in children with new daily persistent headache. But one of the steps is really to think about who are those children, right? And who are those primarily teenagers. And so we decided to put together a survey and ask our colleagues in the American Headache Society. And so we surveyed the pediatrics special interest group of the American Headache Society, and we asked them a number of questions. We had some cases on there which described cases that were more classic NDPH, cases that were more consistent with migraine, cases that were maybe a little bit in the middle. We also then asked some just specific questions about how long do you think a patient has to have has to have a continuous headache to get diagnosed? When do you say it ends? A lot of things essentially just to try to flesh out people's interpretation of the ICHD criteria, and also to try to fill in some of the blanks that really aren't addressed in the ICHD.
So I think this is really interesting. I mean, I think maybe sometimes we underdiagnose some of these conditions just because they're masked by comorbid migraine. I mean, just this morning I saw an adolescent, an older teen who has daily headache, and I had to think about, is NDPH present or not? Were
Mhm.
you surprised by any of the findings in your study at all?
I think so. It was interesting, right? So per the ICHD, you have to have a continuous headache that's been going on for 3 months before you can make this diagnosis. And a lot of people agree with that. About 2/3 of the respondents agree with that. But the other third said, no, I think it'd be okay to be shorter. And so, people even thought that we maybe should make this diagnosis at 1 month. And to my knowledge, there's really no scientific basis for any of these particular cutoffs. So I think it's something we really need to study. The other thing well, a few other pieces that were interesting. So one, there was actually much less agreement on when people get out of NDPH. So if you have the positive experience where a patient no longer has continuous headache, how long do they have to have a break in their headache before you say that the new daily persistent headache diagnosis has ended? And then what do you call them afterwards, right? I mean, so, if they have a break in their headache for a week and then they go back to continuous headache, what is that? Is that the same thing? Is that a different diagnosis? How do you change? And then also the workup was interesting. So, we asked a number of questions about, do you image? What imaging do you order? Do you do labs? And there was a wide variety. We think of it as you have to rule out secondary headache, but how much workup you do to say, checkbox, there isn't a secondary headache found before you make that diagnosis is really variable.
I also thought it was interesting that you mentioned in this paper that as a researcher, maybe some of the outcome measures in NDPH trials need to be different from the migraine trials. As I'm just quoting you here, that headache days per month might not be the most appropriate primary outcome measure.
Mhm.
Do you want to comment on that a little bit?
Sure. I mean, I think, again, this is based on both sort of the opinions that we gathered in the survey and also clinical experience. As you know, right, you saw that child who probably has had, that teenager who's probably had a continuous headache for a very long time. If we make the requirement that they have to have a break in their headache days and have, and be able to reduce a certain number, to say that they're successful in a trial, well, many of my patients would not be successful. But if we want to say that we need to have a reduction in the severe days or the moderate to severe days or a reduction in disability, those are much more achievable, right? Those are often sort of our first wins. It doesn't mean that I'm giving up on trying to break the continuous headache ever, but it's also important to have realistic goals so we can set trials, right? If you look at the migraine trials, right, they're looking at reduction in days, and generally speaking, kids with continuous headache for whatever etiology are excluded. And we need to figure out the outcome measure that's going to be successful in proving something can help to be able to do those studies. So I think it's an important next step to be able to help these patients.
Those are such excellent points, and I think so valid as we try to like think about what might be helpful in a clinical setting. Um,
Absolutely.
Thinking about the clinical setting, what recommendations are, what are takeaways for a clinician from this paper?
So I think that it's important to, well, I think it's so important to really be careful about your diagnosis. When I'm teaching, residents and fellows, I always really emphasize that it's important to think about not just the headache characteristics that the patient has when they present to you, but how the patient got to that point, right? And so, did they develop a headache that was continuous at onset and was abrupt, and if so, think back. What happened then, right? Was there something to point to an etiology that we need to unmask and figure out so we can treat? Or was there nothing that we can find and we still treat it? Did they progress slowly? So I think that that's, figuring that out is really important. What this survey really highlighted is that within that general sort of gestalt of, how quickly did it come on, and that sort of thing, there's also a lot of open questions, right? Is somebody who converts from no headache in their history to, within a week of developing the first headache or 2 weeks of developing the first headache, they're continuous, is that the same as somebody who develops a continuous headache within 24 hours? Or is that more like someone who has a slow escalation over time? Or are they really all the same thing, right? Is it a migrainous phenotype and there's no etiology found, at which point maybe they're more similar than different? We really don't know. There's a lot of things to learn.
I think there's lots of great takeaway points and clinical pearls from this manuscript.
Thank you
Well,
very much.
thank you so much for speaking with me today. Do you have any final thoughts that you want to leave our audience with?
Keep working. Our patients need us to try to help, so keep working at it.
Absolutely. Well, we look forward for more great work from you and your lab as well.
Thank you very much.
Thank you for speaking with me today and have a great day.
You too.